Hello. Your nurse, doctor or healthcare professional has noticed that you have an irregular pulse. You may be wondering what this means and what happens next. You can feel your own pulse at your wrist. It reflects the pumping of your heart. Normally, a pulse should be regular. This means that the pause between each beat is always the same, like the ticking of a clock. But some people have an irregular pulse. This means that the gap between each beat varies. The beating is irregular. Some people are aware of an irregular pulse. They describe this as having palpitations. However, in many people it causes no symptoms at all. There are a number of reasons that someone could have an irregular pulse. One of the more common reasons is atrial fibrillation. This is when the heart beats at an irregular rhythm and can sometimes beat much too fast. Having atrial fibrillation increases your risk of having a stroke. This is why it is important that we find out whether or not your irregular pulse is due to atrial fibrillation so we can give you the correct treatment. The first step is to have an ECG. This is an electrical tracing of your heart. It shows us what type of irregular heart rhythm you have. If the ECG confirms that you have atrial fibrillation, you will need to have a few other tests. This will include a blood test and an ultrasound scan of your heart called an echo. After this, you will see your GP or heart specialist who will discuss which medicines you need. You may need to take a tablet to control how fast your heart beats and a blood thinning tablet to reduce your risk of having a stroke. If the ECG does not show atrial fibrillation but shows a different type of irregular rhythm, your doctor will need to decide what to do next. You may not need any further tests, or you may need an ultrasound scan of your heart. Any further tests will be arranged for you.